Good afternoon or morning, MRIJ listeners. Welcome back to the Maryland Rural Health Association's Voice of Rural Health podcast. I have some great guests on with me today. I have a guest from the Maryland Hospital Association, Frederick Health, and two from the Maryland Apprenticeship Connector. With that, I'm going to allow them to introduce themselves. So, Greg, you're up first.
Hello, everyone, and thank you, Jonathan. My name is Greg Miller. I am the Executive Director of Health Tech Alley. We are a 501c3 nonprofit focused on workforce development initiatives. I'm also a co-founding member of a consortium that backs the Maryland Apprenticeship Connector.
Thanks. Welcome, Greg. Patricia.
Hello, thanks, Jonathan. My name is Patricia Meyer, and I work with Greg through the Maryland Apprenticeship Connector, and I am an employer engagement lead focused on healthcare.
Thanks, Patricia. Jane.
Thanks, Jonathan. Hi, everyone. It's great to be here. My name is Jane Krinke. I'm a director at the Maryland Hospital Association on the Government Affairs and Policy team. Thanks.
Thanks, Jane. And Courtney.
Hi, everyone. My name is Courtney Klein. I am the Workforce Development Specialist at Frederick Health, along with the Apprenticeship Coordinator.
Great. Welcome all four of you to our podcast. And if you were listening in there, we heard the word apprenticeship a few times. So I think that kind of sets the stage to our conversation today, all about Maryland apprenticeships in the healthcare setting. And so just to give us a little bit of an overview of what that's going to look like, I'm going to turn it over to Patricia or Greg to give me just a brief overview.
Me first, Patricia? Okay. So this is Greg from the Maryland Apprenticeship Connector. Apprenticeships are a real thing. There's a movement from the White House on down to the state governors. Our governor is behind apprenticeship programming. In the state of Maryland, we have roughly 11,000 apprentices. The vast majority of them are in the trades, and the majority of them are in electrical. But we are seeing a movement across many non-traditional occupations, including healthcare and technology, educational services, business services, and we're here to advance that programming at both the adult level as well as the youth apprenticeship level, which starts in high school. Patricia, I'll hand to you.
No, I think that covers it. I mean, we can go into other details, but I'd like to do that a little bit later.
Great, thanks. So that gives a kind of a good setting. You know, obviously we've been hearing from the administration that apprenticeships are a huge priority. You know, back in my previous days at FQHC, one of the things that we worked around was getting apprentices involved in the community health worker program, getting youth involved in community health worker program. And so could we maybe discuss a little bit more in depth? You know, we talked a little bit about, we mentioned healthcare, a little bit about the opportunities for apprentices in healthcare, maybe talk a little bit about the apprentices that are out there doing work now and kind of the background of the employers.
Greg, do you want me to go?
Yeah, go ahead, please.
Perfect. So we've had a really great time just taking a look at all of the movement that's happening within both youth and the registered apprenticeship space, in particular in healthcare for the project that Greg and I are working on. And the first thing that I think that I always like to point out is the innovation and creativity that our school systems have put into creating partnerships with their employer partners in their region. So from a healthcare perspective, and certainly Courtney can speak to this in a little bit, we've seen that they've gotten really creative in the types of high school-based apprenticeships or youth apprenticeships and occupations that students are able to get access to. So not just the clinical side, which is what I think we always think about when we think about healthcare. And from the hospital perspective, seeing occupations in the youth apprenticeship program from administrative to maintenance and everything in between. And then the types of employers, like you said, Jonathan, really vary. So we have community health organizations or community organizations having those community health worker youth apprenticeship opportunities, as well as our long-term care facilities. I think those are the primary types of organizations that you'll see in the healthcare space, employing either youth apprentices or registered apprentices. When we think about the registered apprenticeship side, though, the variability in occupation goes down dramatically. We see that apprenticeship tends to focus at the registered side on our clinical occupations as well as our maintenance occupations.
Great, thank you. And you mentioned innovation, and innovative ideas is kind of the theme of our conference this year, which is really exciting. And I was going to ask you, and you kind of touched on it already, but looking at kind of the opportunities for these apprentices, are there obviously some clinical opportunities, GNAs, CNAs, but it sounds like there are some non-clinical opportunities. You mentioned maintenance as well. Is that the case?
Absolutely. Information technology is an occupational area that you see a lot of interest in. There's a hospital that also had an apprenticeship for their environmental services supervisors. So not necessarily thinking that it's just your entry level. You can sort of build apprenticeships for occupations that are at that supervisory level as well. So there's just really an opportunity in Maryland that allows employers to really think about their talent pipeline development in a different way, considering the structural supports that they have between the youth apprenticeship and the registered apprenticeship that is overseen by the Department of Labor.
Great, thank you. Greg, do you have anything to add?
Yeah, Jonathan, I would offer too that we're even seeing some sort of bridging from the care economy to other related occupations. So we're seeing youth apprenticeship programs in early childhood education and childcare workers, not just registered at community health workers. Health Tech Alley, in fact, itself has a registered youth program now for business analytics and data science, kind of bridging technology and healthcare. And so we're really excited to see, as Patricia mentioned earlier, some of the innovative practices coming to the field. And it's really doing a great justice to society overall and creating career opportunities for all people, regardless of background.
Great, thank you for that additional information. It looks like also, I have some data in front of me and some charts, and it looks like there's, over 300 employers kind of engaged right now, and many of them are, school systems, health departments, hospital systems. So it does sound like it's a wide variety of organizations getting involved in this type of work and bringing on those apprentices. Am I correct when I say that?
Yeah, definitely. And I think it speaks to the fact that the systemic workforce shortages are so deep that a lot of employers are getting creative and looking at untapped talent pools. And apprenticeships are a great opportunity to draft your own, build your own, grow your own. And a lot of employers are waking up to that across the board in healthcare.
I love that. And we talked earlier about kind of setting that stage. The administration is really focused on apprenticeship programs and civic engagement and getting, the youth involved in some of these pathways to careers, which kind of, we're out of the legislative session for a few more months until it gets really, really busy again, right? And so maybe, Jane, could you touch a little bit on kind of how the session focused on the workforce and healthcare, this past year, but then also kind of gearing up for the next year's space, kind of the Maryland Hospital Association's focus?
Sure, yeah, happy to. So the 2024 legislative session was a great one for the healthcare workforce. There were several great bills that Governor Moore has actually signed into law, including the Maryland Pathway to Nursing pilot program. This provides wraparound supports to students enrolled in licensed practical nursing programs. And so instead of just covering like tuition and books, this really focuses on those other expenses that can be barriers to someone wanting to pursue a career or further themselves in education. That's like transportation, childcare, housing. And so we know that those are barriers that when removed can really support someone and help them on their journey to a new career. In addition, there was a new healthcare career role created called the Limited Scope X-ray Machine Operator. So not only is this role expanding access to radiological services in the community, since currently only radiological techs can take X-rays, this allows someone who has at least 6 months of healthcare experience and undergoes some training, passes an exam, things like that, to actually take X-rays in urgent care centers and physician offices. So we view this as a real win-win. It's expanding critical services in the communities, and it's providing a new career path that didn't exist before, especially if you're going to become a rad tech. It's a lot of education, a lot of upfront expenses. And so this is a role where you can work and earn money as you go, which we're finding more and more is what you have to do. As you know, Greg said, we have a whole untapped talent pool that have a whole bunch of barriers. And so this is another way that you can remove them, because I don't think there's a shortage of people wanting to work in healthcare. It's just finding out how to clear the path so that they can access it. So we're super excited about those two opportunities that came out of this year's session.
Great, thanks, Jane. And looking at untapped potential in students, the one thing that, so personal note, I always heard when I was in high school, right, that a lot of folks in rural areas wanted to graduate and move elsewhere. And they wanted to leave these rural pockets where there were, vacancies and opportunities. And so trying to engage that youth early into some of the career fields in healthcare and allowing those people to continue to live in the rural areas across Maryland, one of those 18 jurisdictions that Maryland considers rural, I think is a great opportunity. You really touched on 2024 session. Is there anything that sticks out immediately that you could foresee being a hot topic of discussion for 2025, Jane?
Good question. I hope that workforce continues to be top of mind for the legislature. They've been supportive so far. So I know that there was a bill in particular this session that required a report on apprenticeship ratios. And so it'll be interesting to see what those recommendations are. I know the Department of Labor has also been doing some work groups, and there are some reports that we're expecting at the end of the year from different work groups. And so they might bring forward some interesting recommendations. But I think we'll continue to need to pour into, investing in our community colleges, our educational institutions. When you look at the top 10 vacant hospital positions, almost all of that education can be done at the community college level. And so thinking about both how we can invest in our educational institutions and clear the pathway for Marylanders who want to pursue that, I think both of those pathways are critical to help us expand the workforce. So looking for more probably financial investments and just clearing the pathways in multiple ways.
Great, thanks, Jane. As a local foundation board member on our community college, I see the importance and opportunity for youth to receive great education from that 2-year level, and many of those vacancies.
Jonathan, you went on mute.
Okay, we're back. Can you hear me now?
Yes.
Okay, perfect. Well, back where I was, so restarting my thought process. Serving on a local college foundation board here in our local community, I really see the opportunity for students to be involved and tap those 2-year degree programs, many of which Jane had mentioned, are a lot of the vacancies at hospital systems, whether that would be PTA or an OTA or an LPN or an RN program. And so there are a lot of great opportunities, right in folks' backyard to, utilize those students and getting them involved early in education, which kind of segues me to my next thought process here in question. Frederick Health has some apprentices on board, and it looks like there have some maybe some success stories to share, but also, with any program, there are some cons as well. So maybe Courtney could touch a little bit about how Frederick Health is utilizing apprentices.
Absolutely. Thank you so much, Jonathan. So we work really closely with FCPS and their youth apprenticeship program, specifically looking at how we are able to, pipeline in this younger generation. And as Greg was mentioning, kind of grow your own employees. So this gives us that great benefit, which is one of our pros, is allowing us to show and teach our culture and our work environment, to show the students that they can positively impact their community where they live, that they don't have to go anywhere else to do that. One of the other pros, especially for registered apprenticeships, we do have a stationary engineering apprenticeship as well. And that opens up a lot of additional talent pools that we can look and recruit from, because we're not necessarily looking for individuals that have already gone through the schooling process. It really is kind of that entry-level position where we can, again, grow your own stationary engineer and allow us to kind of cultivate that individual throughout their educational program. With With the cons, the cost really is the major con when looking at it. Since we are a 501(c)(3) organization, we don't get any tax incentives, tax breaks, or anything like that. So it does give us a little bit of a pause when we're looking to open up more youth apprenticeship programs and registered apprenticeship programs. So we're always looking for additional ways that we can find grant money and that sort of thing. With the youth apprentices and trying to figure out how we can, again, onboard even more students, the one con that we do see a lot is the limited onboarding time. As an organization, we have to make sure that we are onboarding the students as we would onboard any other employee within our organization, and that they're doing all of the necessary criteria before they start. And with the youth apprentice, we do see that the limiting onboarding time can sometimes be a factor in whether or not we're able to onboard somebody or not. We're always looking for, ways to be flexible, decrease the amount of onboarding time, but those onboarding items that are non-negotiable, sometimes that is an issue with us.
Thank you. No, that's a great overview, obviously, of the successes. And I think that with any good program, there are, some challenges as well. So thank you for giving the audience your good perspective. The one thing I keep hearing is registered apprenticeship programs. And so maybe just for folks that are listening that don't know what a registered apprenticeship program is, maybe Greg, could you touch a little bit upon that?
Yeah, sure. So all registered apprenticeship programs have to be approved by the Maryland Department of Labor. And it's actually a really nice inflection point because essentially all roads lead to one agency. And so they have a database of previously approved employers and workers and apprenticeship programs that can be adapted to new employers. And so there is some paperwork involved, but the programs are built. And like I said earlier, they can be fairly easily adapted. And there's a lot of places to go for help. So the Department of Labor staffs business consultants, which do have reach across the state. The Governor's Workforce Investment Board is compiled of workforce boards that every county in the state is connected to. That's also a place to go for help. And then as Patricia and I are here representing the Maryland Apprenticeship Connector is a place to go for help. So for employers that are thinking about, dipping their toe into these programs, there really is a lot of places to go for assistance. And so I would encourage them to reach out to DOL, the Local Workforce Board, or the Maryland Apprenticeship Connector.
Great, thank you. I remember my time at the health center, we were involved with the Department of Labor and working through some paperwork to get some things approved. And so I understand the process, but thank you for our audience. That's a great overview. Maybe Greg could also touch a little bit on the intermediaries and sponsors and apprenticeship programs and how intermediaries can kind of be a resource to folks.
Yep. And again, as you suggested, another place to go for help. So there are organizations that operate as either a sponsor on behalf of employer groups. So they can take care of a lot of the administration and operational processing of recruiting apprentices, managing apprentices, assuring there's industry recognized credentials that are attained, assuring there's appropriate curriculum for the career path, and just helping employers through the whole process as they engage. Secondly, there's this concept of an intermediary, and they oftentimes help build communities of practice. So like with employers, for example, a partnership with Maryland Hospital Association may have an intermediary attached to them, which are helping employers, meaning hospital systems, identify high demand entry-level occupations that have appropriate career paths that lead to economic mobility for all. But that would cascade to other organizations too, and other occupational areas. So it can be in education services, it can be in business services, it can be in with technology firms. But again, those intermediaries helping design programs, recruit the workers, recruit the employers, and essentially build a community of practice where everybody can benefit.
Great, thank you. We want to keep our members continue to be engaged in this topic. So a couple of things. One, where can folks find more information about apprenticeships in Maryland? And then two, obviously, how can they get in contact with, the four of you? And obviously, we'll make sure we link some information in the description as well. But where folks can find more information, Greg or Patricia?
One of the things I want to point out is, and we'll send you the link, Jonathan, Department of Labor has a great page that lists all of their navigators and the regions that they cover. So they are spread out throughout the state. They're there to help businesses engage in this system, both on the youth side as well as the registered side, on top of links to the Department of Labor website with regards to what registered apprenticeship is. And our macworkforce.org is the website for our initiative. And that also has a really nice workflow and pathways for either students or employers or parents to think about what this might look like for them, and their vested interest in learning more. So there's nice workflows to help people understand what you need to know and to connect you to the right people there as well.
Great, thank you so much. And Greg, you have something else to add?
Yeah, just quickly, just to make sure we acknowledge the Maryland State Department of Education in this ecosystem too. So they are the ones that funded the Maryland Apprenticeship Connector. They work in partnership with the Maryland Department of Labor, as do we, and are really fantastic sponsors, champions for youth opportunity. And they've been fantastic as a partner and sponsor of this initiative as well.
Great, thank you. And before we wrap up, what are we missing? Anything else out there that folks should know about apprenticeship programs in Maryland that we haven't covered yet? Any of the four of you? Hearing silence, I think we covered most of it. And so we'll make sure that we include links in the description of the video. Obviously, for listeners, we'll make sure that we get this out on our social media, but in our upcoming newsletters as well. But I want to thank Patricia, Greg, Courtney, and Jane for being on. This is a wealth of information on a topic that we really haven't talked about before here at MRHA. So I do appreciate you being on as guests and look forward to continuing the dialogue and conversation about apprenticeships because I see the value in apprenticeship programs across the state, and obviously a huge advocate for getting youth involved early as well. And so looking forward to continuing the dialogue, and for listeners, be on the lookout for our next episode. So thank you all.
Thanks, Jonathan.
Thank you.
Thank you.